Namaste, good morning, good day, or good evening to everyone who's joined us from across the region on the second installment of the two-part School Meals in the Time of COVID-19 webinar series. Last week, many of you might have joined us. We heard from state government and representatives of India and global experts on the impact and responses of COVID-19 on school closures and school feeding. We learned how the world's largest school feeding program that reaches more than 100 million children every day triggered its state missionaries to respond to the crisis, which has been a lesson well received and learned by the global community. A key takeaway I felt from the discussion was that the prolonged school closures and its consequences on children's learning and well-being is certainly becoming an increasing concern. We learned that longer children stay out of school, especially children from most vulnerable families. The chances of them not returning back to school increases. So as such, there's now an increased urgency for the government to albeit safely, of course, and that's what we'll also be talking about. The government of India too recently put out a circular about schools resuming on-premise lessons. And many of us who have children, I think we can personally relate to that. With a teenager at home, we're anxiously waiting for schools to resume. So prior to COVID-19, school feeding programs, as you know, has already played a pivotal role in children's learning and attendance. And now more than ever, the need is crucial. So in today's webinar, we will delve into the linkage between food safety and safe school opening, which is very timely and relevant. We have an esteemed lineup of speakers and food system industry experts who will bring to us multi-sectoral perspectives on this topic. So by way of introduction, my name is Mamta Gurung-Yangmi. I'm the Asia Pacific Coordinator for the Global Child Nutrition Foundation. We are a US-based international organization expanding opportunities for the world's children to receive adequate nutrition for learning and achieving their potential. We serve as a global network facilitator for the involved government officials and their partners working towards these goals. In India, GCNF has been facilitating the Learning Exchange of School Meals Program Network. This is a collaborative but evolving, I would say, partnership with some of the most prominent voices in the food security and child nutrition in India, including the World Food Programme, Akshaya Patra Foundation, the Tata Trust, the MS Swaminathan Research Foundation, and IPE Global. And I'm also pleased to officially welcome Tata Trusts to this network. We hope more of you and your organization will join us this movement to amplify the attention on health and nutrition of school-aged children. So on behalf of the network, we thank you for joining us on this webinar today. Before we move on with today's agenda, some quick housekeeping notes. This session is also getting live streamed on IP's Facebook account. The link is in the chat box. If it's not there, we'll share it. So please circulate to your friends who might be interested. The link that we also have, you can directly access without having to register. So hopefully that helps as well to access the event. Throughout the event, our colleagues will be posting highlights on Twitter and Facebook, and we invite you to join the online community. So please do that. We have a Q&A feature at the bottom of your screen if you see. So you are welcome to post your questions. We'll try to get through as many of them during the Q&A session. If your question is for a specific speaker, please make sure you indicate the name so we know who to direct it to. To keep the session interactive, we will also be running audience poll periodically, and we encourage you to participate in these. Results from the poll will be shared towards the tail end of the webinar, and this is about a 2-hour session. So thank you again for being with us today. Your contribution and participation through the Q&A and engagement has been a valuable learning process for all of us through this series, and we look forward to an equally engaged session today. So without further ado, I am going to turn the floor over to our keynote speaker, a brief introduction. CJ, if you can just change the slide, please. Ms. Inoshi Sharma is a civil servant and officer of the Indian Revenue Service. She has held various assignments pertaining to publicity of tax provisions, international taxation vigilance, and the Appellate Tribunal. Ms. Sharma has worked as director at the National Health Mission in Haryana, looking after the procurement of drugs and equipment and adolescent health pertaining to menstrual hygiene and weekly iron folic acid supplementations. Her current assignments as Director of Food Safety Standard Authority of India involves social behavior change and communication, Eat Right India initiative, and extending support to scaling up fortification across the country. She has an interest in area of public policy, administration, and social sector. I must add, when I first met Ms. Sharma in her Delhi offices, this was literally just before the world went into lockdown. You know, at our meeting, her energy and enthusiasm in working toward a healthier India was clearly infectious. And I echo what those who are already working with her and know her knew, that she is a force to be reckoned with and has proven to be a superb champion, not just in India, but globally as well now. Ms. Inoshi will be presenting and giving keynote remarks on Eat Right during COVID, the importance of food safety and hygiene, and preventive measures when schools reopen. Could not have come at a more relevant and timely time. Welcome, Ms. Inoshi. The floor is yours for the next 20 minutes.
Thank you so much, Mamta, and good morning to all those who have joined today for this wonderful session that we are going to have. COVID-19, of course, has posed a lot of challenges to all of us across the world, and child health and nutrition has been one of the key focus areas which needs a lot of discussion, because children are at an age where their health and their development for their future lives is so much important and dependent on. One of the key factors which we thought about presenting today was that how COVID-19, while posing a challenge, has also given us an opportunity to come out with these webinars and forums where the importance of child nutrition, health, and the entire environment and the gamut that is available within the school structure, and how we can address children while they are spending so many hours in school, learn about healthy eating, how that environment can be created. So thank you so much again, Mamta, for this opportunity. And I would like to present here the activities which have been taken up by FSSAI, and how we have also developed certain key initiatives where society, individuals, NGOs, the FBOs, the food sector, businesses, everybody can chip in. And all that effort together can actually make sure that our children have a safe and nutritious environment, they are having healthy food, and they become responsible and healthy adults. So I'll just start with my presentation. If I can have the next slide, please. So why is food safety so important? India is a huge country. We've got a diversity of cuisine. We've got so many street food vendors, restaurants, hotels. Anywhere you go out in the country, you've got eating joints. But what is really important is how safe are we when we expose ourselves to the food that we are eating, and particularly our children. So a lot of children are at risk because of foodborne illnesses. Now, it does not necessarily mean the illness is going to come from eating outside. It could also mean the food that you are consuming at home. If it's not consumed in a hygienic manner, which means if children are not aware, they have to wash their hands. If the food is not covered, if the food is not prepared properly, if it is left out for long periods of time, especially right now when the monsoons are just about to get over and it's so humid, all these put a risk to children. It leads to a number of deaths. It imposes a burden in terms of dialysis, as we can see here. These are all avoidable and can be minimized. Next, please. So what is the mandate of the FSSAI, the Food Safety Standards Authority of India, to ensure safe and wholesome food? What does it mean? One, that food standards and safe practices are followed by the FBOs, or as you can say, from the supply side. So all those factors which come under the supply side, so your restaurants, your hotels, your FBOs, your entire food sector which is providing you food comes under here. Then comes your labs. Your labs are regularly testing the food which is coming out in the market to ensure that they're following certain standards. Food safety compliance. Now that's like the most important mandate of FSSAI, to regularly ensure that once an FBO has got a registration or a license, can we ensure that for a continued and a sustained manner, they keep following the standards and provide us with safe food? And the last is training and capacity building. There are a lot of activities which we've taken, we've taken up in terms of providing sector-specific trainings. For instance, trainings for the labs, training for the street food vendors, training for the FBOs, training for the restaurants and hotel workers. All sorts of trainings are being done under FOSTAC. Next, please. Now here what we are trying to show is the entire chain through which the food is moving, from the farm to the plate. The role of FSSAI comes once the food has left the farm. So all your crops, your livestock, your seafood, once they are ready, they have been, like for instance, the crops. So agriculture is what would look after the crops. The animal husbandry after the livestock and the seafood. The fisheries department would look after, for instance, the seafood. Now, once they are ready and they have entered the supply chain, that is where FSSAI's role comes. So the very process where the food has to be processed, it has to be stored, it has to be transported, it has to be distributed, and then it comes into the retail. Till that stage, FSSAI ensures regular inspections, lays down standards, and ensures that safety and hygiene is maintained. Now, when we come to the last circle where it is called preparation, that is the individual private sphere. So you cannot have, for instance, rules and regulations which you can impose on the individual. But then how do you generate that awareness among consumers to tell them that what they are eating, is it healthy enough? Is it prepared in a safe and nutritious way? Are they consuming it properly? Are they eating mindfully? So for all this, we have initiated another activity under the FSSAI, which most of you must be aware of. It is called the Eat Right India Initiative. Next, please. When the Eat Right initiative was started, the entire idea was that we have to project FSSAI not just as a regulator, but also as an enabler. So what does FSSAI primarily do? It enables that people eat safely. How do we enable it? When we are talking about safety, we are making sure there's no adulteration, there's no toxic levels in the food, there are no pesticides available. When we are talking about healthy, what are we saying? That you eat nutritious food, you eat diversity of your food, you eat a balanced, wholesome food. And sustainability means what you are eating is not just good for your body, but it's also good for the planet. So once the food processing has taken over, you've consumed your food, how do you dispose of with your waste? The oil which comes out from the industry or from your cooking or frying at home, what do you do with the oil? How much water are you consuming while the preparation of dishes is taking place? Or what is the carbon footprint, for instance, of creating a certain food product? Is the carbon footprint of creating, say, a burger similar to creating a simple lentil and a rice dish? No, it's very, very different. All these three factors together lead to the Eat Right movement, which primarily aims at social and behavioral change. Now, under the Eat Right movement, what we had envisaged while we were going to promote Eat Safe, Eat Healthy, and Eat Sustainable was that in every sphere of an individual's life, we push these three concepts. So starting from the home, we've got the Eat Right Home concept, where we try to create a lot of social and behavioral change among people of how to eat safe and hygienic and wholesome food at home. Now, when you leave the home, either you go to the office, you're traveling, there the concept of an Eat Right campus comes. That in a campus, the administrators or the people who are running the office, or for instance, any higher education institution or a hospital or a railway station or an airport, all those people are also mindful of the kind of food that you are going to eat. And then comes children. Where do children go? Where do they spend the most of their wake-up hours? It's in a school. And what the teacher, I'm sure, says is, God's word. I mean, I could say anything to my kids, they don't listen to me. But ma'am ne kaha hai, ma'am said it is like the law. I'm so impressed when the teachers say to my kids, please have sprouts, please have green vegetables. This Friday, you people have to bring a healthy tiffin. I'm so grateful because that day, whatever I put, I'm sure they have to eat it and when they come back. That is the kind of school environment where we are talking about, where the child is not just learning about science, not just about proteins, carbohydrates, fats, vitamins in the science, but no, they're also learning about how important is a particular food product for their body and why is it that they should not binge on sugar or high salt, fat, sugar snacks, and why it is so much more effective to have peanuts or bananas or fruits, for instance. So next, please. So what is it that we are trying to tell in this Eat Right School is teaching children early about handling, preparing food safely and making healthy choices. It's very interesting because yesterday I was reading an article of how in UK they've suddenly recognized that entire generation of children have lost, you know, the very satisfaction and knowledge about cooking, because home science or cooking classes which we had in school when we were young have suddenly got eroded from a lot of schools, from a lot of places in terms of the children's education curriculum. It has just been removed and it is now being reintroduced. I'm so grateful we still have it in our country, and that is what actually, you know, brings you a sense of satisfaction when you are cooking your own food. You know what ingredients are going, and then when you are consuming it, you know how grateful your body is for that energy that it's getting. Next, please. So what is the school initiative that we've started? We've got a lot of initiatives which a lot of ministries have started. And what we've done is we've tried to bring it all together under the Eat Right initiative of our school program. So the Ministry of Health and Family Welfare have started a health program under Ayushman Bharat, in which while they were providing the whips and the albendazole tablet for iron folic acid supplementation and deworming, they have also introduced with MHRD a school curriculum program which has 11 broad subjects ranging from mental health to adolescent health to health and hygiene and wholesome diets, nutrition. Now, there are three key topics which are aligned with the Eat Right School, and we are in fact supplementing their programs with our yellow books. So the program that we have initiated is something which is aligned with the MHRD and the MOHFW, and we are pushing the idea of nutrition and hygiene among school children. So we've got a rich repository of resources. We've created a yellow book which has very simple, Q&A, very simple games which the teachers can share with the students, and students through a very playful way get to know about germs, contamination, adulteration, and a healthy diet. Next, please. We've also created an Eat Right matrix. So currently, if I just give a status about the schools which have registered with us, and because of the lockdown, it's kind of stopped, but we are hoping once schools reopen, they would be, you know, joining in with this program. So we've got over 35,000 schools who've registered with us, and we've got over 4,000 health and wellness ambassadors who've been created in these schools. So the health and wellness ambassador could be a teacher or could be a student from the grade 11th or 12th. And these ambassadors primarily work with the administration and the teachers to develop the curriculum that we've given in a manner which suits the school calendar so that the awareness building can be done. And we've got over 42,000 various sort of activities which have been conducted in schools through the last year. So these activities could be anything ranging from a simple debate or a skit or a poster or a slogan competition. It could be even in some schools, they've taken up the activity of collecting waste and making it into compost. So anything which creates awareness about the planet, about nutrition, about wholesome food, about local seasonal fruits and vegetables is what we've done here. And our certification process, which happens, is an online certification process which schools can do. And it is valid for 2 years. Next, please. So these are the 5 steps which are involved to become an Eat Right school. The school simply has to register on our online portal. They have to get one health and wellness ambassador registered, actually 2 of them. And then they have to conduct certain Eat Right activities. Eat Right activities are the ones which I just discussed, and again, put them up on the online website. And then based on the activities they are doing, we give scores. The scores are also mentioned, what scores they will get. And at the end of the entire matrix, you get, after filling it up, you get the Eat Right School certification. Next, please. So this is the portal which we've created where all the information that I was just talking about is available. So that little circle is on the right hand side is where you can register yourself. And below the yellow little bit you can see are the yellow books that I was talking about. It is available in a number of languages which schools can easily adopt. In fact, parents who are interested in, supplementing some of the coursework that students have currently can also refer to this book because it's all available online. Next, please. So the matrix actually has 3 sections. Section A is regarding the curriculum, which can be adopted by the school. Section B is for government and government-aided schools, where we are already promoting many of the government activities, like under WASH. We have to make sure that potable water is available and sanitation facilities are available, or WIPS or albendazole is being provided to the students. And Section C is just for schools which have a kitchen or a tuck shop or a food vendor, and just to make sure that they are all registered with FSSAI under the Schedule 4 and are also following the guidelines under Schedule 4, which ensures safety and hygiene of the canteen. A lot of parents sometimes mention that what should we do because in the school, children are only getting junk food, or they are getting food which is high in salt, fat and sugar. And I always tell them that as part of the PTA or as part of the open house meetings that are held with the school, please request the administration that since it is your child's health which is at stake, they must request or talk to the vendor and introduce healthier options. So instead of having some deep fried potato chips, you could have peanuts or salted mixed nuts or a trail mix, something like that, makhanas, bhuna chana, which are not expensive and are very easy to keep. Instead of keeping sweetened juices, you could keep coconut water, you could keep lassi, you could keep any other regional like kokum, any other regional drink which is available. Next, please. These are the resources which are available, which I was talking about. These resources are available also on the Diksha platform of our Ministry of Health and of our Human Resource Development. And these are available in English, Hindi, Assamese, Bengali, Punjabi, Gujarati, Marathi, Kannada, Tamil, Malayalam and Telugu. And we are also in the process of getting it translated in a number of more languages which are left out. And our website link is given where all these books are available. Next, please. We've also recently launched lesson plan booklets, which are a detection of adulteration in food samples. So these booklets are available for teachers, for students between grade 3 and 10. And we have created these booklets grade-wise. What is really, really beautiful is that they are very, very simple tests which children can do in the classroom, and they can even take it back home and share it with their parents and do these little adulteration tests at home. We are hoping that in the next few years, we do not have to use these books only. It's quite unfortunate that we have to, but because this was something that not many people were aware of, we thought that we should develop it. And recently, On the 7th of August, in fact, we had the Honorable Health Minister releasing these booklets. Next, please. So we are also in the last stage of coming out with our school regulation. There was, in fact, a lot of discussion about it in November and December last year, which is the Safe Food and Healthy Diets for School Children Regulation for Safe and Healthy Diets in Schools 2019. It has been approved by the government. It is just on its way to get notified in the Gazette. What it primarily says is that once this regulation is out, schools will have to make sure that any person, vendor, mess in charge, any food vendor in the school will have to get themselves registered and licensed and have to follow the schedule for food safety and hygiene practices, and that children within the school cannot be exposed to foods which are high in salt, fat, and sugar. Also, these kind of food items cannot be sold within 50 meters of the school campus. Food business operators cannot sell their products within the school, which are HFSS. Neither can they sponsor any activity in the school where their products are displayed. Next, please. And what we are primarily hoping is that schools will be promoting the very idea of a healthy diet through this. What it really means is that we have to, many times when we talk to children, they're like, oh my God, I don't want to eat healthy food. That's horrible. I don't want to eat your ghas foos anymore. Why do they get that idea? Why do they make that face? They must be hearing from their peers. They must be hearing their parents talk about it, friends talk about it. Somebody is talking about it, that that's junk food, when it's actually good, healthy food. And the junk food has actually taken a precedence over their main staple diets. It's not bad once in a while to indulge yourself, but that's the whole point. It's just once in a while, not a regular activity. So what we are trying to do with this regulation is not go against anybody's bread and butter, not tell people that, oh my God, we do not want your child to have this. All we are trying to say is that while children are in school, on one side they are learning in their science and in their other books about healthy diet, you cannot expose them on the other side to food which does not balance with what they are learning about. Next, please. And this I've talked about. Next, please. So we are also very soon going to come out with an Eat Right Creativity Challenge. We'll be launching it in another 2 weeks' time, which will be open for students from class 1 to 12, in which we are going to come out with poster making and with a photography competition for students to, come out with some beautiful poster about what they think is Eat Right. We are going to link it with COVID-19 so that we also get a feedback about how children are, reacting to COVID-19 and how they link it with food, because many times the idea of food as something, which is actually enabling your body in terms of developing its immunity and therefore fighting off certain infections and diseases is what we are also trying to promote. Next, please. We've also come out with a Eat Right handbook, which during COVID-19 we have tried to put forward to various, to the parents and to the schools also, which has these simple guidelines about how precautions can be taken during COVID-19 and how people can actually adopt practices of eating right. Next, please. And we are very shortly also going to come out with guidelines for canteens to follow in schools. This, I think, would be most important here. Food and safety hygiene guidelines for safe reopening of the school mess and canteens. So this guideline will actually help, the school administration in, following certain steps and making sure how the food handlers are trained, how teachers and students can also follow simple guidelines so that safety and hygiene can be maintained. Next, please. So that's it. Thank you so much. I just hope oh my God, I have overshot. I get so excited when I talk about these things. Thank you so much.
Thank you, Inoshi, ma'am. And we know, she is such a champion and an advocate because she's running right back into another webinar talking about these important issues. But we hope you can join us back later for the Q&A session. So thank you so much. You really bring home, the role of the government, not just as a regulator. I think what you mentioned and highlight so well as an enabler. And that's a lesson that many of us can take from what you've presented to us. We really appreciate. I guess we'll let you go now and we'll move on with the agenda and hope you'll join us a little bit later. Thank you. So moving on with the agenda, we'll now go to the next segment, which is a moderated plenary. And this will be led by one of our colleagues, Ms. Jayashree. Can I also ask my colleagues to do a quick reminder that to all of our friends and colleagues who have joined us today, we are throughout this session going to do a mini poll. So maybe if you can just show the first one, release the first one, and we encourage all of our participants to respond towards the tail end. We'll share the results from the poll. So you see on your screen. And the first question is, the longer vulnerable children are out of school, the less likely they are to return to schools. Do you agree, disagree, don't know? Just wanted to get an appetite of those of us who are on this session to see what you're leaning towards. That'll stay on for a couple of minutes and then we'll share the results. So moving on in this panel plenary, which is going to build a little on what we talked about last week, but looking more at building an ecosystem to augment the government's guideline. Ms. Inoshi shared with us a little about what the government has in place for the safe food provision during COVID, as well as when schools reopen. As we know, the issues of hunger, education, and economic development are not removed from each other. We cannot address them in isolation. And school feeding programs have always played, and now more so, play a very important role in achieving that, particularly when we combine it with complementary activities, as we just heard about the WASH elements, infrastructure, the nutrition education, so on. From our engagement with countries around the world, we've learned that it is equally important to bring leaders from governments, businesses, and nonprofits to connect on these issues and to create a stronger, more coordinated strategies for addressing them. And the panel and the speakers that we have testifies that. So without further ado, I'll introduce all of our speakers and then hand it over to the moderator for this session. We will first hear from Mr. Bharatasaba Dasa, who is the regional president of Akshaya Patra Foundation for Delhi, NCR, and Uttar Pradesh. He oversees also the government liaison in the state of Uttarakhand. And as we learned last week, the state of UP alone is, the population is the size of Brazil and certainly runs one of the largest school feeding even within the country. Mr. Bharatatasa, in the response of COVID-19, has swiftly mobilized an emergency team and has impressively managed serving 80,000 meals every day to distribute, as well as 150,000 grocery kits. These are indeed no ordinary achievements, and we thank Mr. Bharatatasa so much for his commitment and dedication and for making time to be with us today. He's going to be sharing the NGO perspective. This will be followed by Mr. Shekhar Sethu. Mr. Shekhar Sethu is the Director for the Food for Development Office for Southeast Asia and Oceania at Tetra Pak India Private Limited. He spearheads the development of the dairy and food value chain through cooperation with customers, governments, development cooperation agencies, funding organizations, and NGOs all over the world. Mr. Sethu has been a speaker and has also authored and presented papers in India and overseas on issues concerning nutrition and health for over 2 decades. We learned that he's also an amateur photographer and wild enthusiast and nature conservationist. So quite a multi-talented individual we have amidst us, and we are really looking forward to hear from him on the role of private sector in the food safety, which certainly cannot be ignored. He will be followed by Mr. Vivek Arora. Mr. Vivek Arora is currently a senior advisor to Tata Trust in India, where he works with the nutrition team on projects addressing malnutrition and fortification of foods. Mr. Arora has over 25 plus years of experience in varied food products, production, greenfield projects, and management. Previously was also the CEO of a multinational company managing therapeutic and supplementary foods for the malnutrition children. Mr. Arora is passionate about working with food systems and addressing the challenges of malnutrition. And to the plenary discussion, he will bring with him the public-private partnership and the perspective. Finally, this whole session will be moderated by our colleague, Ms. Jayashree Balasubramaniam, whose work in media and communication for over 2 decades has traversed a wide range of social issues, HIV/AIDS, prevention, child health, nutrition, water, sanitation, agriculture, and food security in the development sector, as well as in the corporate sector and in the media. At MSSRF, she has taken forward the foundation's goal of linking science and society through various strategies and contemporary communication approaches. Jayashree has previously worked with ICRISAT, UNICEF, and with Bill and Melinda Gates Foundation. In a media career, she was the bureau chief of South India with India Today's television networks. She's also an academic researcher of media science and has written and broadcast extensively in popular media in 3 languages. So as you can tell, this is quite an extensive and esteemed panel we have of speakers as well as the moderators, and we're really looking forward to hearing from them. So without further ado, Jayashree, I pass it over to you.
Thanks a lot, Mamta. It is in fact National Nutrition Week. So these webinars are extremely timely, not just to remind us of what we need to do to get these school meals restored, but also to look at how important these are in the context of child nutrition, especially for school-going children and also children who are accessing ICDS services, in fact, the Anganwadis. So as the introductions of speakers have been done so kindly by Mamta, I now hand over to the Akshaya Patra Foundation's regional president. The Akshaya Patra, as you are aware, is working on a concept of centralized kitchens for quality and ensuring that safe food reaches children across multiple states. So we would also like to understand some of the safety concerns and how these could be addressed. So over to Sri Dasa here.
Good morning to all of you. Thank you, Mr. Jayashree, and thank you, Mamta. So I would like to start with sharing my screen. Can that be allowed? So I think that my screen is visible to all of you. So I will start off. So before we, I would like to discuss largely on the role of NGOs and how they can contribute towards nutrition delivery, and how we have been doing our activities. I would like to outline how we have been active during the COVID times, and what all we have done, so that as a brief background, and I have some suggestions for what should be done in future, so as to ensure that we fight this COVID situation and come out victorious. So as you know, Akshaya Patra is an NGO which is serving midday meals in about 12 states, 2 union territories, in 52 locations. We are currently serving in about 19,000 schools, total of about 1.8 million meals all over India. Every day we have been serving, and our mission is basically to ensure that no child's education is disturbed because of hunger. That's our mission statement. And the whole seed for how did Akshaya Patra began was from our founder of the Hare Krishna movement, Srila Prabhupada. His wish has been like our seed for this whole program, which has become the world's largest school meal, one of the largest school meal programs in the world. So Srila Prabhupada, the founder of the Hare Krishna movement, was once present in a place called Mayapur, which is a hamlet about 200 kilometers north of Kolkata. So at that time, after a ceremony, when he was sitting in his room, he heard some group of children fighting with stray dogs. And when he heard this, and then when he peeped outside the window, he saw that they were fighting with stray dogs for scraps of food. So this, he tears came in his eyes, and he instructed the leaders that you should ensure that no one is hungry within 10 miles radius of all our centers. So this was the genesis of the Akshaya Patra Foundation. This was our inspiration. And in Bangalore, we started first feeding with 1,500 students in 5 schools in the year 2000. And now, as I said, we are serving in 1.8 million meals in 12 states in across 52 locations all over India. So this has happened because of wonderful partnerships which we were able to get with the state governments, with the central government, and various corporates all over India and all over the world. That is what has been been instrumental in taking the seed of Prabhupada all over the world, and ensure that we take this mission and feed the hungry and ensure that there is no hunger. That has been our mission. So when we look at the problem of hunger, it is said that as per the Food Security and Nutrition report, state report, so at that time, it said 2 billion people do not have regular access to safe, nutritious, and sufficient food. So basically, this means that many people are there's various schemes from the government, like this midday meal is one of the schemes where we are partnering, and there is the Anganwadi, where the women and child department, and we feed many people. So like these various schemes are there, public distribution schemes are there, but in spite of all those schemes, about 2 billion people do not get regular access to safe food. This is a reality. This is the current reality. And due to this COVID pandemic, it is estimated by the United Nations World Food Program that the number of people who will face acute food insecurity, as you know, there will be a huge economic meltdown after this is happening, and because of which many people will lose their jobs, and because of which all these realities, there are 130 million people who are facing huge food insecurity issues will double to 265 million because of this COVID. So in this scenario, the seed of eradicating hunger and the food assistance programs is a very, very important initiative, I would say, for ensuring that these problems, these people who are going to get affected because of the COVID and the other scenarios should be served with food, and food should be reached out to them. So what we did was, in Akshaya Patra, we have a very large midday meal kitchens which can serve anywhere between 10,000 to 1 lakh meals per day. So using this infrastructure during this COVID, we used this, and we cooked the meals in these places and distributed the cooked meals. We also have a very dedicated staff trained to monitor following all the food safety standards. All our kitchens are FSSAI certified, and we have very proper systems to ensure that the cooking happens in a very hygienic conditions. We ensure that the food is very that we even have a quality expert on board who ensures that the food is cooked as per the standards, and the very nutritious, high tasty food is delivered. We even have a mobile kitchen which can go and support in disaster relief areas. We cook this kitchen on wheels, it's called. We can set up these kitchens in we can go and set up these in vans which can go up and set up in just a day's time. We can start cooking food for about 20,000 people per day. So we have all these capabilities with us. We also have capability to pack ration kits, and we have and we also have a huge set of volunteers who would like to contribute and support our endeavors for eradication of hunger. So using all this, what we did was that we served close to about total of in 5 months 80 million meals we have served in 52 locations in 18 states and 2 union territories. So this we served in just since the lockdown has happened in India, and we have got support. We served these cooked meals. We did in two broad initiatives we had. One was cooked meals. Cooked meals largely what we used to do is that we used to identify places where people would be having a lot of hunger issues and they'll be bereft of food. So there we did that in collaboration with the state governments, and there we set up units where we could serve these food and people would come and assemble and take the cooked meals. This was one, freshly cooked meals was one initiative. And another initiative was we made ration kits which had rations to serve for about for 21 days, 2 meals per person. So each kit could serve a person. So for 21 days, 2 meals, and almost about 8 lakh kits have been distributed, which translates to about 33 million servings. So Akshaya Patra played a direct role in these servings. We did this service all over India, ranging from Delhi and in NCR, Karnataka in the south, Andhra Pradesh and Telangana in the south, and Gujarat, Madhya Pradesh, and Maharashtra, and in Odisha in the center and east of India, and in the northwest we served Rajasthan and Uttar Pradesh, in where I am stationed out of from our center in Mathura. We have served lots of ration kits all over, and we have served cooked meals too. And in the east, we have touched places in West Bengal. We have also served in Tripura. We served in this some tribal regions where we reached out ration kits to many children, and very houses where young tribals were there. We reached out even to their houses, these ration kits. And in Assam, we have served these ration kits in various parts of Assam, Guwahati, and other places. So what happened because of this program was this during this COVID lockdown situation, we were able to provide very good food assistance and solve food insecurity issues, which would have actually compounded, because of a lack of food and lack of nutrition. We were able to address it within hours, whatever bet we could do, we did that. And we ensured efficient management of our resources available on hand. We set up a simple team very quickly, and we were working on day in and day out from morning and evening to do this distribution. So as the unlock situation changes now, what we have diversified is to give out what is known as happiness boxes for beneficiary children. What already the government is giving some level. Government of India is providing rice and wheat, so to a lot of families in the below poverty line. So what we are doing is that we are providing, apart from rice and wheat, some of the nutritious dal and these other items. We are providing packets of glucose biscuits, ragi flour. These are all and a proper stationery also is there in these kits, and we are distributing. I feel this is a very important initiative that should be taken up. As we know, the schools are going to in a phased manner going to open up. So in this scenario, many of the children are not able to come to school. So maybe some portions of children will come, as we know, as the keeping in line the social distancing and other aspects. Only maybe 1/3 of the children may be allowed to come in different days. So other days they'll be bereft of a meal. So it will be very good. This happiness box can feed for a child or for a whole month. So this will be a good happiness box kit which could be distributed. The midday meal program can also be diversified to giving these rations to the children. This is our suggestion to this is to tackle this. How do we open as these COVID safely opening the school? This would be a very important initiative. And in this, what we also suggest is when the school reopen, as we know, because of this economic meltdown, the whole children and all of them will be largely affected by they may not get a full whole-day nutritious meal. Already the current nutrition value that is given in the midday meals and in the ICDS is based on giving a 1/3 of the meal what we are giving in the midday meals, or the Anganwadis are supposed to meet about 1/3 of the nutrition value. Given the scenario that there will be there may be many of these families coming from the economically weaker section, may be bereft of even a wholesome meal. Apart from this, we suggest that there should be the meals in the midday meals and in the ICDS should be revised, and menu should be revised so as to get a higher nutrition value. Currently, for a primary student, it is about 450 calories and 12 grams of protein. Maybe this should be a proper research can be done and can be increased by a small proportion, so that the child gets enough nutrition, just like Miss Inoshi Sharma said, that how there will be a problem of nutrition. That nutrition is the means to fight this COVID, to increase the immunity. So I would say this would be a very important initiative to change the make this midday meal menu better, more enhance the menu. That's what I would say. That would be a one way to tackle this problem that is going to come up as schools are going to reopen. Further would be another is give supplemental additional supplementation should be given with the ICDS beneficiaries, and because there are many ICDS caters to a large section of people who are acutely malnourished. So for them, a nutritionally dense menu should be evolved. Further nutritionally dense menu should be involved so that they can fight this scenario of this COVID, in this COVID scenario when these things open up. And we have to have a more holistic approach how to deal with this program of this nutrition that is going to malnutrition, that is going to be a big issue as the things unfold now. And largely we also are ensuring we should have proper training to the MDM service providers and those who are giving this in this field of midday meals, and others should be given more training towards ensuring the food safety, so that there's no prevalence of any spread of this COVID because of these feeding programs. So we have ensured that we have done that in this, even in spite of all this in this COVID situation, we have ensured we have served, like I said, over 80 million meals. So we have ensured that there not been even one case of any report of any COVID spread through this midday meals, through these serving programs. So I think that should be duplicated in these schools so that this can be done. Further would be more because this largely, as I see going forward, there may be shifts. The schools will open in shifts. So this it will be a very good time to start with the national breakfast program, I would say, because many of the children may come very early to the school and they may have to leave early. So maybe a school breakfast program to start with can also ensure this nutrition lacking. So what we would want to do is that as a post-COVID in this scenario, we would like to collaborate with and have partnerships with various other NGOs and ensure that and with the governmental organizations, and ensure that we can increase the many of the and channelize these efforts to ensure that nobody is affected because of hunger and malnutrition. And I would say this hunger and malnutrition is a bigger problem than just the COVID itself, because when we started the program, we were impressed. We found that one thing that moved all of us in our team as Akshaya Patra was one of the laborers, migrant workers, was saying that COVID may kill us or not, but hunger can kill us, will definitely kill us. So that was like our that propelled us to act, and our Srila Prabhupada, his words that hunger-free world you ensure, was the propellant for us to act. And we would also request to the governmental agencies and all NGOs to work together to ensure that this problem of hunger and malnutrition is solved. Thank you.
Thank you very much, Sridasa, for that very holistic overview about the efforts that have been taken two key words from your presentation. One was with regard to actually boosting the immunity. More than ever now, we are talking about the need to boost immunity of, of the people, especially of children who are depending on the school feeding program. So many states are rolling out dry rations instead of hot cooked meals because that's much simpler. What is your take with regard to having freshly cooked meals or having dry rations? The logic being that with dry rations, at least the food is reaching the people, and logistically it might be more difficult to deliver fresh cooked meals. But I would like to have your understanding on that, please.
Yes, I think definitely, given the scenario of this COVID, and where there will be scenarios where many of the school children will not be attending, like I said, to the schools. Even if they may be in batches, they may come alternate days to schools. That may be a scenario. Given all this, I feel the ration kits definitely should be should come more to the foreground and should be done. But it should be ensured that it reaches to those children only and their family. So that should be ensured. Ration kits have a better serviceability in this scenario of COVID. Yes, but I think still the cooked meal will also have its place, because we found that many people came to our centers where we are serving the cooked meals during this COVID, and they're very happy to receive, because many of these people stay in places where they may not be able to cook properly. They may not have be hygienically, they may not, in their slums or wherever they are, they may not have hygienic situations. So in this scenario, I think both should go hand in hand. Maybe we should have some more of these Amma canteens and such kind of facilities maybe should be set up in those hamlets where there is a lot of food insecurity issues are going to be prevalent. So there we should have subsidized meal kind of a canteen should also be set up. I feel both should go hand in hand, but ration kits will definitely have a better response and better serviceability in this scenario.
Here to deliver, basically.
Yeah.
So thank you very much. We will come back to you because there's already a question out there. But we're moving on to our next panelist, Mr. Shekhar Sethu. As we heard from Inoshi Sharma a little earlier today about food safety, and reaching protein is really a very critical part of addressing the protein hunger among the population in India. So I hand over to Mr. Sethu, and I think he begins with a video. Is that right?
Yes. Thank you.
The world is facing food security and nutrition challenges. We believe building sustainable food value chains is the most effective way to tackle these challenges. For more than 55 years, Tetra Pak has worked with customers, governments, and NGO partners in the development of school feeding programs. Today, more than 72 million children in 58 countries receive milk or other nutritious beverages in Tetra Pak packages in school. 85% of school feeding programs are government funded, and milk is the most widely used source of nutrition worldwide. School feeding programs have proven to reduce malnutrition and improve school attendance. Impact studies have been conducted by program stakeholders in several countries. In the Dominican Republic, chronic malnutrition, anemia presence, and vitamin A deficiency have been reduced significantly. In Myanmar, children's weight and BMI increased, while school dropout rates were reduced. Inefficient agriculture is another challenge. 41% of the world's milk is produced by smallholder farmers, and much of it is lost due to insufficient collection infrastructure. Our dairy hub model aims to secure a long-term supply of locally produced quality milk without raising the cost of collection in emerging economies. It does so by linking smallholder farmers to a dairy processor through a one-herd concept. We offer hands-on practical knowledge and training. We have seen around the world how this model increases locally produced milk supply, increases farmer income, and enhances the stability of dairy supply chains. With our work, we address the Sustainable Development Goals, such as SDG 2, Zero Hunger, and SDG 17, Partnerships for the Goals. We provide technical assistance to our partners and share best practices used in school feeding programs worldwide, building sustainable food value chains and making food safe and available everywhere.
Over to you, Mr. Shekhar.
Yeah, thank you. Right, so the earlier slide, please. Yeah, so now the private sector perspective, and I'll also spend a few minutes talking about practical food safety solutions in the COVID times. Next slide, please. The Tetra group actually consists of three companies, Tetra Pak, Dilabal, and Sidel. All these three companies are focused on technologies for efficient food production, packaging, and processing of food. And we cover the entire value chain from cow to consumer, or in case of school feeding programs, we can say from cow to child. Next slide, please. We have a very glorious history with regard to school feeding. We introduced our first school milk program way back in 1962 in Mexico. And I'm happy to share that this program is continuing even till date, right from 1962. And millions of children are participating in the school milk program. At this point, I want to just pause and say something about food for development. Food for development actually drives the entire development of the dairy and value chain, food value chain, through cooperation with our customers, with governments, with development agencies, and various partners. And this we do across the world. And through our various activities, we actually add value to our customers. And at the same time, we support development of emerging countries and provide access to nutrition worldwide. And when school feeding programs or school milk programs are run for a long period of time, and all of us know that, it improves health and nutrition of children. And when these programs are implemented well and managed well, then they actually act like targeted interventions, and we can achieve best possible results through good implementation. Next slide, please. Our vision of our company is that we commit to make food safe and available everywhere. And I was listening to all the previous speakers, and the food safety and resonates with the government, with the NGOs, with private sector. It's a very important link that I see. SDG 17, all of us are partnering with one another in our a passion for food, for safe food, and especially in such challenging times. Next slide, please. The food safety challenges in schools, and I speak because we interact with a number of colleagues across the world, and the food safety challenges in today's situation has actually got even more accentuated, and we know it's already challenging with this COVID times. And what Tetra Pak does is it offers packaging and technology that can actually be very practical in situations like this. No cold chain, difficult infrastructure, roads, floods, and in all the situation, our packaging actually offers a very unique solution. Next slide, please. And I want to actually dwell just a few more minutes about talking about what is ultra heat technology, or UHT. So milk is taken to, let's say, 135 degrees centigrade and held for about a few seconds. And when we take the milk up to such high temperatures, harmful pathogens and the bacteria can actually be killed. And then we hold it for a few seconds and drop it down to room temperature and pack it in aseptic packaging in aseptic surroundings. So, and the beauty is that this elongates the shelf life of milk or any other food, and we don't add any preservatives, and we retain all the nutrition. So this is the extreme value that our packages and the technology brings. Next slide, please. I'm going to give you a closer look at the 6-layer packaging that we have. One is that it prevents external moisture. Two, the aluminum foil keeps away light and oxygen so that the food is preserved and so are the flavors. And the other beautiful thing about this is that this package is sturdy enough. And we heard even in the previous webinar how these packages withstand transportation and storage in different states of India. And they've proven to be very good across the world as well. And this is the 6-layer packaging of ours. 75% is paper and 25% is polyal. Next slide, please. I mentioned in the video as well as in the previous one of my sentences that we actually offer practical technical assistance. We have experts around the world who actually know how to implement school feeding programs. They've been doing this since 1962 on a global scale. And this helps in actually providing laser sharp focus on what benefits or what desired results we want at the end of a program. And we personally prefer programs running for long periods of time so that children can benefit, their health and nutrition and even education improves, and that we know these are all correlated. Next slide, please. In India, interestingly, there are lots to learn from our midday meal program and the Anganwadi program. And what was interesting was that even during this challenging COVID times, certain states actually took this opportunity, took this challenge and converted it into opportunities. And so they delivered food and milk at home, and those children never got deprived of nutrition. This is something when the schools start opening up, I'm sure that different countries can learn from India and India can learn from other countries as well. And this coverage is actually expanding state by state. Next slide, please. And now I want to actually round off by talking about a little bit about recycling. And this is a topic which is very, very close to our heart. Globally, about 25% of our Tetra Pak packages are recycled. But in India, we got a report from TERI, which is the Energy Research Institute, in the cities in which the study was conducted. About 53% of all packages of Tetra Pak are recycled, and which is a very, very good thing. And we are environmentally friendly and keeping in, we're compliant with the law. But I wanted to mention that even before this legislation of paper straws, etc., kicked in, we were actually compliant. For 15 years, we've been recycling our packages, and this is something that we're very, very proud of. And the footprint is growing. We are prepared for actually, even if we have to double, we have the infrastructure necessary for this particular activity. But I also wanted to say that I was asked this question in one of the earlier seminars that I was participating in, that even our wood that we use in the for paper is also sourced from responsible forests. So that's how the FSC label is there. So we are extremely fortunate to be recycling our products, and we can convert them into tables and chairs and roof sheets and notebooks, and they all go back to benefiting the children in the school. Next slide, please. I want to round off by saying that Tetra Pak offers technology and packaging which are very good for food safety. Two is that I also want to mention that we offer technical assistance to governments and other partners for implementing good school feeding programs. And finally, our packages are recyclable, so they're very good for environment. Thank you.
Thank you very much. That was very crisp and also very, very quick overview. One of the important things to me is the milk that is, of course, as you mentioned, a number of states have started implementing this, and Pondicherry, for instance, is a forerunner in starting breakfast and providing milk and things like that. So where do you see either the opportunity or the convergence between the private and the government sector and actually ensuring safe delivery at a time like this? And how do you suppose it could be practically rolled out? We're talking about a huge country which is with local states taking their own decisions. So your thoughts on that, please.
The first and foremost is one of the key stakeholder in this is the dairy farmer, and most of our customers who are interested in such a program. And Bharat Dasa mentioned this little while ago of a breakfast program. It's a gap, I think, in our nutrition offering to our children in schools. And this can be bridged through the dairy cooperatives who are very competent to have excellent products that can be served in schools. And I think that's my dream, and as well as my belief that this is a crucial nutrition gap that can be addressed. And I think a lot of people are talking about this to the government at various levels. And I was fascinated by the way the Anganwadi program has been delivering milk to children in some states, and we know that from some states have actually made an excellent presentation on that. So I'm looking forward to that actually.
So thank you very much. There is a question on dietary diversity, but before we get back to that, inviting our speaker for the day, Mr. Vivek Arora. Just also to place in context that we've been talking about different models and different types of implementations. Like we have Akshaya Patra, who's actually delivering the meals. We have Tetra Pak, which can help make the connect between safe delivery of protein or milk to children and and the corporate perspective. And we have Mr. Vivek Arora now with Tata Trusts, who have also been doing considerable work in terms of relief and rehabilitation, but who will also provide their insights on how do we take it forward from here now. So over to you, Mr. Arora.
Thank you, Jayashree. And as I was listening to panelists, could relate to what kind of partnerships Tata has and how we are contributing and how uniquely we are placed to present this today. How uniquely we are placed to share our partnerships with all of you. So we can move forward to the first slide, where what is the vision that is guiding us. So when Mr. Ratan Tata retired from active business, he said, I want to do something for the children and pregnant mothers in India. So that's something that we, the nutrition team visualizes, and we build all our programs around it. And also how Tata Trust is placed, how we are achieving it is basically entering into partnerships. So we believe that, we can do good, but alone, but then it's better, we can do better when we are more than one and we partner. So we can see now, we can go around in next slide, please. We can see how, this nutrition at Tata Trust is divided into 3 pillars. So one is the product part, which is the, actual product delivery. The second pillar is the platforms. So how we support the platforms. And then the third is the policy, advocacy, and data piece. So these 3 pillars. In the first pillar, in the product development, we have food fortification and affordable nutritious products. In the second platform, we support the ICDS, MDM, PDS, which are already delivering. So we strengthen them to deliver better. And then the third pillar is where we engage with institutions, where data is generated or policy data is generated to take decisions on policy matters. Also advocacy is done. So we have food fortification resource center specifically for fortification. Then we have a Tata NIN Center for Excellence in Nutrition, which does nutrition surveys, and we have this Swasth Bharat Prerak program. So now these 3 pillars, how they are transforming into partnerships is the next slide, please. So if you look at the first pillar, then we have a direct linkage. We run kitchens for the tribals. Now these kitchens are slightly different from just providing one midday meal. We will see it in details. And the second partnership is the NDDB gift milk scheme, where we are supporting to deliver fortified milk. So milk getting delivered, and then you are adding to it and ensuring that the milk that is getting delivered is fortified. And then we have certain programs with different state governments for fortified rice. And also there is a private partnership with Mars Incorporation. This is the makers of Snicker chocolates. And they have a foundation, an initiative, Mars Affordable Nutrition Initiative. So we've developed a product. We are the knowledge partners. We've developed a product which is kind of a replacement for snack, which is nutritious. So, you cannot change the habit of snacks, and then you provide an alternative which is more nutritious. Under the second pillar, we have this Nutrition Resource Center, which is supporting the Poshan Abhiyan in the country. And then we have a technical support unit to the Niti Aayog. So this is, supporting the platforms and, contributing towards the policy and guidelines. The third pillar, we have relationships with FSSAI, where, in the morning, Inoshi ma'am was talking about FOSTEC and Farm to Fork. What we are doing, how we are helping them is that we've created an experience center at FSSAI, and also we are contributing to the digitization of the content there. And we already discussed about the Tata NIN Center for Excellence. So next slide, please. Next slide. This is the kitchen program. So here, why it was important? So, there is already a program wherein the tribal children in the ashram shalas, so these are hostels basically. So they get all the 3 meals by the government. But you can see the photographs, how the meals were prepared. So there are 589 such schools and 189,000 kids across Maharashtra. And see the condition in which the food is getting prepared on wood fire and the way it's kept in open. So there was definitely a need there to intervene. And these are the most remote places in Maharashtra where the tribal children are. Next slide, please. And so the value proposition that Tata came out with was a central kitchen model, which will provide all these 3 meals. So right from breakfast plus 2 meals, lunch and dinner, to this ashram shalas. And this will be like a hub and spoke model, where one of the schools will be converted into a hub, and then it will provide food to the schools, all the rest of the schools. And the uniqueness about this is that this is hand in hand with the government, and it's a common account where you handle the finances jointly with the government, and then try to deliver in whatever budget the government has, and you try to deliver the best in that budget. And we've been very successful in this. Next slide, please. If you look at the next slide. So this next slide shows the depth of the reach. So these are the most, backward areas of Palghar and Nashik, where this food is getting delivered to the schools 3 times every day. Next slide, please. So with this, we did a baseline, midline survey, and what we found that we were able to reduce anemia by 11%. Also, the underweight went down, below 10 years, underweight went down by 9%. And these meals, when you check these meals, they were, exceeding the daily requirement for nutrition for that particular age group. So this is what we found out after evaluation. We have testimonials from the government officials who are very satisfied because they could deliver this within the budget. And you won't believe it's something unique that since it was a new project for us at Nashik and at Palghar. So Nashik, the vendors are supplying to Taj Nashik, and the vendors in Palghar are supplying to Taj Mumbai. So that kind of, quality was ensured that these vendors are supplying quality material for the kitchen. The school principals also, they were very happy because their main job is teaching, and so it was very cumbersome to prepare meals and provide them. So they get ready-made meals. So they were also very happy with getting nutritious meal ready-made delivered to their schools. Also, the doctors, we contacted the doctors locally, and they said that the number of visits by the children, because it is hostels and it's regulated, so they said the number of visits have gone down, and overall the health of the children have improved. So this kind of partnership with the government is quite unique, and we are able to bring in the private players who are supporting these initiatives. Next slide, please. Coming to the second partnership, this is the school milk feeding program, where we have partnered with the NDDB Nutrition Foundation, NFN, and their 200 ml of fortified milk is given to the school children. As on date, 50,000 children through this program are getting the milk. Next slide, please. So the uniqueness here is that not only NDDB and NFN, but all the cooperative dairies, the producer companies across the country, and also the public sector units, because we are using their CSR to provide this milk. So they are all coming together for this cause. So this is a very unique kind of partnership, wherein it's a multi-stakeholder partnership, wherein there is a kind of a package. So if you want to feed 5,000 children with milk every day for 1 year, you need 175 lakhs. So we have that kind of packages ready-made for public sector units to just opt for a package, and then rest everything will be taken care of in partnership with the cooperative dairies, the NDDB. They don't have to manage anything, and they will get in is a daily update on how much milk is delivered today, and how many children consumed the milk today. So that kind of arrangement is there under this project. Next slide, please. The third one is this Mars Incorporation partnership that I was talking about. There is a product called Gomo. It's a snack. It's an alternative to all this, fried potato chips and similar kind of products. This is a nutritious alternative to these snacks. So basically, here we have tied up with Mars, and then the delivery, the supply chain is taken care of by development partners like Dharma Life, Sakal, RGNVP, Seva. So they are rural marketing this product. This is not the conventional channel of distribution. This is something very unique to the rural segment, where the vulnerable population is getting this nutritious snack. We have a GN4AF, that's a foundation, Good Nutrition for All Foundation. It is a Tata Trust Section 8 company, which operates this whole Gomo distribution supply chain, which manages the supply chain of Gomo. Next, please. Now we move on to rice fortification. Basically, we have piloted in 2 states. So to begin with, it is Andhra, wherein fortified rice is provided to children in MDM and ICDS. So I focused where the partnership is for the children, and it is benefiting the children. It's West Godavari, Krishna, and Guntur district, where 0.8 million children are getting fortified rice every day. Next slide, please. So what we are trying to achieve here is that we're trying to address the micronutrient deficiencies of the children. This rice is fortified by iron, folic acid, B12, vitamin A, and B6. So we are able to, whatever is needed by the children, we are able to provide them the micronutrients. That's the objective of this program. 26,000 metric tons of fortified rice has been delivered, and there are 9 rice millers on board. So you can look at the private player contributing here. So we are then tying up with the rice millers to ensure that the rice is fortified to the required standards and is supplied to the schools. Here, the partnership is in between the government of Andhra Pradesh, the rice millers, and also the Andhra Pradesh Civil Supplies Corporation, who is taking care of the distribution. Next slide, please. The rice fortification in Maharashtra is slightly different from Andhra because here we have a partnership with BPCL. So we have engaged a public sector unit here who from their CSR have contributed towards fortified rice in the district of Gadchiroli. Here we are fortifying the rice with iron, folic acid, B12 and B1. So we started this pilot in 2 blocks of Gadchiroli, which is Kurkeda and Bamgarh. And now it has been expanded to all the blocks. So we've added 10 more blocks in Gadchiroli. Gadchiroli is the most backward, I would say, district. And the most vulnerable population is there in this district. What we are now planning to do is we have an excess rice there and the capacities are there. So we are now scaling up to the adjoining district of Chandrapur from the same rice millers in Gadchiroli. So we are expanding this program and we are in talks with the Maharashtra government to see that this is expanded to all the districts of Maharashtra. Next slide, please. Now coming to the Nutrition Resource Center, this is how we are supporting the Poshan Abhiyan, which was started in 2018, initiative by the Government of India. This is basically the objective was again to address the malnutrition issues of mothers, adolescent girls and young children in India. So how we are supporting this is that we have a network of Swasth Bharat products. This one Swasth Bharat product is there, commissioned in each district who works with the district administration, either the collector or the district magistrate's office, and they they are augmenting or they are strengthening the programmatic activities in that particular district. So we provide the policy and technical support and monitoring and evaluation in that particular district. Also, we have a technical support unit to strengthen and support Niti Aayog for Poshan Abhiyan. We have done the rapid assessment of ICDS services and this take-home ration in 20 states now in this COVID situation. And very soon we are going to come out with this compendium of what relief measures were done, in this COVID times. Next, please. This is the NIN Center for Excellence. Along with NIN, what we are trying to achieve is a national nutritional health survey. We've already done this survey in one district in Nalgonda in Telangana. Other various studies are being conducted at national levels to generate data because data will be important to decide or make policy decisions in future. And we see that, in the area of nutrition, there is very less credible data available. For this, we have roped in NIN and we've also, for cross-learning, NIN researchers are trained at National Health and Examination Survey, which is a gold standard for survey. So they have been trained now and then they'll conduct this survey for us and generate data. The next slide, please. So this is the relationship with FSSAI. We've already discussed in brief in the beginning. So this is one is the experience zone that is housed on the fifth floor of the FDA Bhavan in Delhi. And this is a walkthrough of India's food systems. We've tried to use AI to see that it is more interactive and friendly. And we organize school visits to create awareness among children about food safety, food systems that are available, so that they can get a first-hand experience. We are also we've learned from Inoshi ma'am in the morning that about yellow book and pink book and other kind of material that they have already created. What we are now helping them is that we are digitizing all this content so that the delivery is better. If you look at what Inoshi ma'am shared was that there are 35,500 schools that are enrolled. and only you have 4,183 ambassadors till date. So how to reach this 35,000 schools better? So digitization is one thing that we can use to disseminate whatever is created by FSSAI better and reach this 35,000 schools. Next slide, please.
Yeah. We're just getting quite a few Q&A questions also. So we could soon after you finish, we can get into that. Yeah.
Yeah, this is the last slide. So to conclude, I'm just summarizing. So as we reopen in this new normal, so this public-private partnerships are very important. You've just got a sample of what kind of partnerships can happen, and one organization, how they can partner with the government, with private players, with development sector people, and do better. So look at the first one. What we need to do is improve the nutrition delivery through school meals. That is one area that we need to work on. Advocacy for modification in the existing guidelines or set up new guidelines. We need to do behavior change communication. We need to create nutrition awareness, education and training, and also focus on hygiene and sanitation. So I think some of the points were also raised by Mr. Premadasa, so from Akshaya Patra. And this is what we need to do as we reopen. Also, the kind of public-private partnerships that can happen. So there are three kinds of partnership, and I think we qualified in all the kinds of partnership that can happen. The first one is a philanthropic public-private partnership where you donate in cash or kind and you contribute. The other is the transactional kind of public-private partnership where there is a high level of interaction in between the partners, where you share the same principles and goals. I would say what we are today, it's a transactional kind of partnership where we are all getting together and sharing the same principles and goals with each other. And then there is the transformational kind of public-private partnerships where, the highest level of engagement, the Niti Ayogs and the ministries, that there the multiple partners are also there, and then you do large scale social changes through those kind of transformational partnerships. So with this, I conclude my session. Thank you very much.
Thank you very much. We have a few questions, some of which have already been answered. But since our audience who's watching this live on social media wouldn't be able to see the questions, just quickly running through them, which is the modalities of providing meals by Akshaya Patra as Rita Bhatia, and that has been answered by the state-of-art midday meal kitchens. Shri Bharata Shabadas has answered that, giving a link to how the kitchens work. Deepak asks about dietary diversity. Indeed, I think this is a question that is very important, and perhaps Sharika would also address that in her closing remarks, where Sridasa has said that India has different staples, and the automated, semi-automated kitchens should be able to cook the menu meant for that region. Indeed, that's the idea of having these freshly cooked meals, that you have region-specific, location-specific nutritious foods. Again from Rita Bhatia, and Mr. Shekhar has answered this question in terms of delivering the cost and the, within the cost, managing large-scale programs for food safety, where partnering with governments, Mr. Shekhar has said that in 57 countries across the world, and there is a value seen in the packs which retains nutrition while delivering this and making it logistically convenient. Akshaya Patra's cost is 12 to 14 rupees per meal for a child, whereas for an adult it would cost to 22 to 25 rupees per meal, says Shri Bharata Shabadasa. And this is to a question asked by Deepak on the cost of optimized meals. So coming to one of the questions which Mr. Shekhar said he's going to answer live from Manoj on how the Tetra Pak is currently supporting school feeding. So Mr. Shekhar, over to you to answer this.
Yeah, so I wanted to say that, the Tetra Pak, along with its customers, so we don't do things linearly. We work with our partners and our customers. Along with them, with the state governments and the national government, we work with them, and there is a budget, and the state government usually chips in, and the customer also joins in, and then we work out separately the whether it is an Anganwadi program or through midday meals or a special program, because as we know that school milk programs, there are also special state government led programs which are there in the country. So by and large, I think in partnership with the government, we are able to manage this. This is what is managed.
So thank you for that. And a question from Gautam from Nepal, where there are two kinds of practices, where there's cash transfers and support in kind, such as by WFP. So where he says the cash model is not satisfactory and there is not a strong mechanism of midday meal. What do you recommend for Nepal? I think this question is probably answered best by Shariqua, unless one of the panelists wants to have a take at this. So this is on whether cash or kind. So Shariqua, would you like to answer that?
Can I just come in and suggest Mr. Dasa, as an NGO that's supporting the government of India implement such a large-scale program, may also be able to respond to some part of this question.
Yeah, absolutely. So, Mr. Dasa, if you're online.
Yeah, I'm online. I'll take you after Dr. Shariqua gives her.
Yes, please.
Sure. Thank you so much for that question. I think from the Indian context, what's been proven very well is that a hot cooked meal in schools is perhaps the best answer between cash, etc. But different contexts require different solutions. And whatever is the solution that Nepal chooses, it has to be context specific. But what I can say from the Indian experience is that the hot cooked meal and the provision of the same in the schools is something that has worked very well for India. Over.
Thank you, Shariqua. Mr. Dasa, to you, please.
Yes, I agree with this point that there is a issue of giving cash. You see, cash has its own, will it really reach the child? That's a big question, because that is, in fact, India earlier was giving a dry ration program. The whole midday meal was not there pre-2000. So in 2001, that cooked meal program was implemented. So it has been, I would say it has been very successful in India. And I think Nepal will have to look at implementing that either in centralized models or in decentralized models with smaller kitchens in schools or hub and spokes. Maybe one school can become a hub where the main cooking happens and the smaller other schools are used. Ultimately, a cooked meal will always be the best in reaching a cooked, a nutritious meal to the child. That will be most effective means. And as we have seen in India, it's been very successfully implemented.
Thank you, sir. This is next question from Rita, who says...
Sorry, Jayashree, before you move on, Mr. Vivek Arora from Tata Trust also wants to speak to a little on the in-kind and the cash modality. So can we give him...
Yeah, absolutely. In fact, the next question is actually addressed to him, which says that good to know that you're monitoring and measuring the impact. So probably you might want to just club the two questions to talk about how the impact of hot cooked meals is also probably being measured. Over to you.
Thank you, Jayashree. So just to add on cash and kind. So our choice would be kind to begin with, and I would support by saying there are 3 A's: affordability, accessibility, and availability. Now, we may, by providing cash, cater to the affordability part of it, that you're giving cash in hand. But is good nutritious food accessible where we are providing the cash? Is it available? So this other 2 A's are a question. And what in India context, what we have seen is that the other 2 A's are very difficult to achieve. If you're able to achieve, yes, as Dr. Shariqua rightly mentioned, that you can use both the models, but it has to be a judicious decision to see that is it accessible and available, and then you can solve the affordability issue. So that was my answer on the cash and kind thing. Regarding the impact evaluation, at the trust, for all the programs, what we do is that there is a baseline and there is an end line that we try to achieve. And we engage with a third party evaluation company or a partner, wherein, an independent neutral evaluation of the program is done, so that we understand that what are the shortfalls or how we can improve the program in the coming future, and whatever we've done, what we've got out of that particular program. So that's about the impact evaluation.
Thank you. And also to bring in Ms. Inoshi Sharma here, because she spoke about social and behavior change. So besides the availability and accessibility, also looking at people's awareness and actually taking, the power of purchase that they have to buy nutritious food. So I'd like to bring Inoshi in here, please.
So yes, in fact, it's really important, to bring about consumer awareness, because many times, there is a lot of, it's like both ways. There's a lot of assumption that if you keep a product on the shelf, people will pick it up. So it's quite natural. You may find some interest, but also always you've got some sort of marketing, right, which takes place around a certain product which is launched or put before in the market. So if you've got fortified products out in the market and people start buying those, there is generally this awareness which has been created about its benefits and people are purchasing it. There is a certain word of mouth, the trickle down effect, and then by and large, everybody starts buying it. And then you suddenly realize that's the only thing people are buying. We buy salt. We don't even think we are buying iodized salt. I mean, that iodized salt is so part of our, it's salt which is available. It's the same way with rice, or it's with wheat flour. After some time, when everybody starts buying it, it wouldn't be a question to ask, is your rice fortified or not? Of course it's fortified. It would be something like that. Adding to the discussion that we were just having regarding ready-made food and take-home ration or cash transfers to beneficiaries in the school program, I mean, what was discussed, I just want to reiterate. Our country is huge, and as of now, even while we are providing hot cooked meals, we do face off and on challenges. But that has proven to be the most effective way throughout the world in providing nutritious food to children. So the cash transfer benefit that we are talking about can take place, but not immediately. Maybe after a few years, when things have been brought to a state where we no longer have issues of micronutrient deficiency, where we no longer have issues of people, at PPL levels, or we have issues of providing PDS. So that was my take on it.
Thank you, Ms. Inoshi. We have one specific question to Mr. Shekhar on how the Tetra Pak is supporting the school feeding now currently. And also the other question on lactose intolerance. You could possibly take both these questions together and talking about them.
I haven't managed to see them on the screen here.
The first question is how the Tetra Pak is supporting the school feeding, and is it also part of the midday meal in India, or is it additional? And the second question is that there have been challenges regard to lactose intolerance in countries. So do you also look into that?
Yeah, one of them, the first one I've already answered live, if you recall. On lactose intolerance, well, there is actually very scant evidence available on this really. Whenever we do a school milk program, we work with the children and work on milk acceptability among children. And usually we have found that once the program runs for a few months, and then we do an acceptability survey among the children, overwhelmingly the children love the milk. So there is, on lactose intolerance, really the jury is still out, is what I would say.
Thank you. The next.
And there are scientists who are better qualified than me to answer that question. This is what our experience has been.
Okay, so we'll park that later. Maybe it can be brought up in another person's reply as well. But there's an important question about enrollment of children and children returning to villages with their migrant parents. Addressed to Akshaya Patra / others, it says that new children had to be enrolled, and does anybody has anybody tried to cover these children other than those who have been enrolled? And the second one is those who have returned to villages with migrant parents. So first starting with Akshaya Patra and with others to add in, please.
Yes, the government itself is having various initiatives by which nobody drops out. They come back into the net, even though June they may have been enrolled and they may not have been enrolled. That is immaterial. When the school starts, all of them will be taken into the system by the existing schools and through the government initiatives itself. That itself will ensure that they come under the net of the MDM. That is one aspect, and we are also in many places ensuring, as an NGO, going and meeting, ensuring that those people who have missed out are also added into the lists wherever we are serving in the midday meals, whichever school we are, because at the end of the day we want that the meals reach everybody. You see, we are serving in that area, in that school. Let us say we want every child in that area who is a very needy beneficiary to take these meals. So we also extend a hand in that count. That's my answer to that.
Jayashree, I would like to add here.
Yes.
See, what we've understood working on ground in the field, that this area of migrant, the children, with the migrant parents, was something which was left out over the years. Now they've realized that, when the children migrate with their parents, they are left out of certain schemes. There is a specific focus now to ensure that these children are enrolled in. So there are specific schemes going on for children of migrant workers, also to see that, they are brought into the mainstream. So it was something which was left out few years back, but now there is a focus on this and it's getting taken care of by the government.
So thank you very much, Mr. Vivek. And I think this might be something that Dr. Shariqua would also address in the closing remarks. Since we are nearly, reaching the end of the session, I'll just read out the next couple of questions, which says, is fortification an economic sustainable way? I think the simple answer to that is yes. And Puneeth's question on fortified meals, and Mamta will be answering that. So just before I hand back to Mamta, I'd just like the panelists, I mean, it's been an excellent brainstorming session, but if there was one immediate recommendation that you would make that should be implemented now, if you could just maybe in 30 seconds give us, what is that one immediate step that should be taken up by public, private, government, state governments, if you could just talk about that.
So
we can start with Sri Dasa and Mr. Sethu and then Mr. Vivek in the same order that you had the panel. If you could just sum up, and Ms. Inoshi could just come in on that as well. Yes, please.
Yes, I would say that one thing, if you want to say that, then let's say start the breakfast program in all the schools. And if there is a ration made available for that, maybe that those who are not able to come in the breakfast time, those rations are reached to those households. That would be a very good way to address this malnutrition issue that's going to come up.
Thank you, sir. Mr. Shekhar.
I would say that embracing, there are new technologies available for food safety, proven technologies available for food safety, and there is immense amount of savings that the government can do by reducing food wastage and in logistics and transportation. Such packaging solutions are available, and that would be my one take. for today.
Food safety packaging. And Mr. Vivek?
Jayashree, my take would be to include fortified inputs. In this COVID times, everybody is looking out for immunity boosters. And I would like to mention here that you can fortify with vitamin A and D, which both contributes to your improving immunity, as well as, you can fortify with zinc, iron, folic acid. So I would say in school feeding programs, include fortified inputs, and that would definitely contribute towards better health.
Thank you. And Ms. Inoshi, the last word to the lady.
Thank you so much. I would say that, one thing, of course, is, that we practice what we preach. So at schools particularly, I would say integrate the Eat Right School program, integrate habits so that children actually adopt them and not just learn and forget about them. And like everybody summed up, even in the school canteens, if we can have fortified products, in our everyday lives, if parents can buy fortified products, if we just believe in what we are saying and we actually do it, the issue of micronutrient deficiency will just come down gradually. For FBOs, if they can adopt products which they can fortify, a lot of activities under CSR can be done to create consumer awareness about it. In fact, we are engaged with Tata Trust in carrying out certain activities with regards to milk and oil fortification, with milk actually, and with rice. With oil, we are engaged with GAIN, with PATH and WFP on rice. So we are working with our developmental partners to create that awareness among people. Thank you.
So thanks a lot. Some good ideas in there, which we will be documenting and sharing back. So thank you for being a great panel. And I hand over now to Mamta to take the proceedings forward.
Thank you. Thank you, everybody. That was really enriching, a lot of learning, and it was beautiful to see all the different sectors and perspectives coming together, but talking about the same issue, that is around school health, school nutrition, immunity, partnerships, etc. I do want to invite my colleague Shariqua, who's the head of nutrition and school feeding unit at WFP, some of what we've heard today, but just a little bit of a remark of over the two-part series that we talked. But before Shariqua comes on board, Sijo, Mary, can you just do another quick release of the poll? And that can stay while Shariqua makes her remarks. So Dr. Shariqua, over to you, please.
Sure, thanks. Thanks a lot, Mamta, and thanks so much to all the panelists. It really makes my job easy. A lot of the issues with regard to school meals and how do we make them functional once the schools open. I mean, there's a lot which has been said. So my job is definitely easy in terms of just summarizing what has been said. As we know, school closures in response to the COVID-19 pandemic was an unprecedented risk to children's education, protection, and well-being. There were disruptions to instructional time in the classroom, and that can have a severe impact on the child's ability to learn. The longer the vulnerable children are out of school, the less likely they are to return, particularly those who are attending school irregularly. Therefore, it's important that we start thinking about how the schools can be opened, what are the actions that need to be taken as far as school opening is concerned. In India, most of the schools were closed in March and they continue to be closed till now. Various state governments are coming up with dates when the schools will begin to open, especially in the government sector or the government-aided schools. And there is likewise a similar movement in the private schools in the country. But the school reopening will need to be made safe. It would need to be consistent and it would need to be aligned with India's overall COVID-19 health response, with all reasonable measures taken to protect students, to protect the staff, the teachers, and their families. We are well aware that the midday meal scheme represents a predictable support and lifeline for millions of school children in the country, and it has a significant impact on children's daily diet. Alongside the opening of schools, the midday meal scheme will also need to be made functional at the school level with the provision of a hot cooked meal. And some of the factors that need to be considered while doing so include keeping the risk of transmission for school children, teachers, and the cook cum helpers at the lowest possible. So the actions that the panel talked about was in terms of, given the fact that COVID has impacted dietary diversity at the household level, perhaps the school meals need to be re-looked at from the prism of nutrition. Some of the suggestions which came in with regard to that was to perhaps have a relook at the calorific and the protein norms that the midday meals provide, perhaps increasing it from what we know as the 450 and the 700 kilocal to something else, to ensure that fortified foods are provided to school children so that the necessary micronutrients are available to them. We are aware in India that from some of the data and some of the work which has been done by the National Institute of Nutrition, that if we look at the recommended daily intakes of micronutrients and we also look at what is the intake on ground, there's a huge gap, and that gap increases when it comes to school-age children, and it increases for both the sexes. Therefore, fortification offers an excellent opportunity in terms of fulfilling that gap. Some of the other measures that were talked about was that, especially in the government schools, there are these kitchen sheds. Most of the government schools have also been used as quarantine facilities for the returning migrant workers. Therefore, before the schools are reopened, all the rooms and on the premises of the school would need to be sanitized, and there would need to be standard operating procedures that would need to be developed for the daily cleaning and sanitization of the school premises. We are aware in the government sector in India, the infrastructure which is there on ground in terms of the kitchen facilities, the toilet facilities, the drinking water and the hand washing facilities may be less than desirable. And therefore, in view of school reopening, especially given COVID, some of these may require an infrastructural upgrade. We would need the development of standard operating procedures on procurement and storage of food. How do we safely store food, which were points that were alluded to both by Mr. Shekhar Setu as well as Inoshi ma'am. And there are guidelines which are available from the Food Safety Standards Authority of India in that regard. So how do we ensure that the guidelines available from some of these institutions reach down to the last mile, perhaps to the most tribal outlet school in the state of Gajapati or in the state of Orissa, or to the last hamlet in the northeast. So these guidelines will need to begin to be rolled out. There's a very important need for the capacity building of the cook cum helpers and the sensitization of school teachers. The cook cum helpers are the cornerstone of the midday meal program in India. They do go through the regular trainings from the government, but perhaps in view of COVID, there's need to organize digital learning so that the knowledge of the cook cum helpers can be updated on hygiene, safety, and social distancing in schools. We might perhaps need to develop some short videos as to how, what are the measures that the cook cum helpers need to take while preparing the meals and while distributing the meals as well. Perhaps coming to the responsibility of the parents, I think given the school reopening in view of COVID, the parents and the school management committees and the parent teachers associations would then have a very important role. Their role would need to be broadened in terms of the monitoring of the midday meals. They would need to be encouraged to be present during the food distribution and to ensure adherence to the various preventive practices against COVID-19, both amongst the school children as well as the cook cum helpers. The headmasters and the school teachers would need to plan and ensure that all the points which are mentioned in the SOPs, etc., are understood and well operationalized. And of course, like everything else, we have the Arogya Setu. We would also need to perhaps understand how the Arogya Setu app can be better used by the headmasters and the school teachers in ensuring that safe midday meals are delivered to the school children. I think I've managed to cover all the points by the various esteemed panelists. In case I may have forgotten, my apologies. With that, I hand it back to Mamta. Thanks a lot.
Thank you, Shariqua, for concluding so beautifully and capturing, all of the interesting points that were made. Thank you again to all our distinguished panelists and speakers. We really appreciate your commitment to advancing child nutrition and school meals. Much thank you to all of our participants who've joined. And I think other than North America, it looks like we've had participation from most of the other continents. I'd say we had folks joining us from Africa and Kenya, Japan, as well as the Oceanias, my home country, Nepal. There are quite a lot of good questions there. So thank you everyone for staying with us. Can I also ask colleagues to release the poll results that we had? Quickly, if you could release that. Behind the scenes, many of us were working to put this two-part series together. So I must mention Nidhi and Nilima from Akshaya Patra, Sijo Pushpendra Mukta from IPE Global, my colleague Mary from GCNF, and Sanjana and Manisha from WFP India. Thank you so much for all your help. So you see before you, the first response, we got 92% responded that the longer vulnerable children are out of school, the less likely they are to return to school. So today's conversations around opening schools safely was very, very timely. And the second was, okay, can we have the answer to the second? So the second question was, when designing any large-scale national response to COVID-19, food and nutrition needs of school children should be considered. It was a unanimous agreement to that, 100%. 32 respondents replied and all agreed that it's important. So with that, we conclude this very important discussion we had. We'll keep in mind, as GCNF, I know we're also working to put together a virtual forum for our global audience, that we do a similar conversation. So please be alert. We will be sending you emails around that, but it's really encouraging. And thank you again, all our colleagues who've helped us put this event together. Have a good day, namaste, and yeah, if anything, I think what we can claim from this region is making namaste popular in the time. So stay safe and onward. Thank you.
Thank you.
Thank you. Bye-bye. Thanks a lot.
Thank you. Bye-bye. Thank you.
Bye.